Welcome back to Tiny Teeth Talk, the study channel for dental students and residents. Hit subscribe and the bell icon to stay updated with every new videos. Now let's jump in. Today we are continuing our series with nitrous oxide sedation part 3. We will be doing a deep dive into the why behind its use, covering clinical indications and contraindications and weighing the advantages against the disadvantages. We will also break down the stages of anesthesia and the specific clinical signs and symptoms you need to monitor in your pediatric patients. Start with the purpose. Why we should use nitrous oxide sedation? To reduce fear and anxiety. Due to previous unpleasant experience of child or parents, child may have developed fear of visiting a dentist, and as a nitrous oxide has euphoric and anxiolytic properties. Euphoria is a state of intense happiness or well-being, and anxiolytic means something that reduces anxiety, helps a child feel happy and relaxed while sitting in the dental chair. It can help in reduce fear and anxiety. Enhance communication of child with dentist. Due to fear and anxiety, child is unable to talk to dentist freely. So by reducing fear and anxiety, child and dentist communication will improve. Instills a positive dental attitude in children for the dentist and dental treatment. Even though a child may be cooperative for dental treatment, but he may not like visiting a dentist for complete treatment or preventive treatment. Since nitrous oxide has euphoric and analgesic properties, children enjoy getting the treatment done and may look forward to subsequent visits. These instills a positive dental attitude in the child for the entire life. Improves the quality of dental treatment. Many dentists struggle treating a child and would like to complete their work in the shortest possible time, thereby compromising on the quality of treatment. Nitrous oxide is used to bring about minimal sedation, so unwanted tongue and lip movements are reduced. These factors contribute towards improving the quality of dental treatment. Increase efficiency of the operator. A dentist is able to accomplish more work in a single appointment with the nitrous oxide gas than without, because less time is spent in managing behavior of the child, which enhance the efficacy of operator. Reduce fatigue. With the use of nitrous oxide gas, less talking or verbal distraction is required, which reduce the fatigue of the operator. These in turn improves the overall efficiency of dentist, as he or she is able to treat more number of patients on a particular day without getting tired. Reduce gag reflex. Gagging interfere with various dental problems such as taking x-rays, making impressions and restorative treatment. Sometimes this response is so strong that it may lead to an avoidance of the dental treatment. So by depressing central nervous system, nitrous oxide increase the threshold of required to trigger the gag reflex. Reduce stress environment. By controlling all of these or managing all the problems, there will be an unstressful environment. Indications. When you can use nitrous oxide. In apprehensive and fearful children, examination of the child with previous negative dental experience. Intraoral examination should be done using nitrous oxide in children who appear to be anxious in the first appearance. Attempting examination without nitrous oxide may further increase anxiety in such children. Examination of preschoolers, examination in special children to help in reducing their anxiety, building trust as well as confidence with the dentist, to reduce the perception of time and reduce fatigue. During the course of treatment, even a cooperative child may say that he or she is tired and doesn't want to get more treatment done. These can pose a problem in completing the planned treatment or practicing quadrant dentistry for a child. Using nitrous oxide alter the sense of the time in children and thereby assist dentist in performing uninterrupted treatment for children. To control gagging. To perform a procedure for which profound anesthesia cannot be achieved. Many times, extraction of an abscessed maxillary tooth, pulp therapy in a tooth with acutely inflamed pulp can pose a challenge because the local anesthesia administered using the infiltration technique may not be effective enough to perform the procedure without causing pain. In these scenarios, use of nitrous oxide can be of great benefit because of its analgesic properties. Medical history. Nitrous oxide sedation is best suited for children falling under ASA category 1 and 2. We already discussed what is ASA and what is ASA category 1, 2, 3, 4 in our previous video. For children under ASA 3, prior consultation and opinion from primary care physician or consulting medical specialist is necessary. Coming to contraindications, chronic obstructive pulmonary disease. We cannot use in child with chronic obstructive pulmonary disease because in COPD there is a difficulty in breathing and shortness of breath. In this condition, there is a poor exchange of gas in the lungs leading to hypoxemia. Check out previous video of conscious sedation to know detail about this. Bowel obstruction or abdominal pain. It may cause abdominal pain due to distension of abdomen. Because nitrous oxide expands trapped air, it can bloat the digestive tract leading to pressure related stomach aches. This is why dentists usually recommend a light meal or no meal 2 hours before the appointment to keep the stomach empty. Middle ear surgery, infections or otitis media. In children, eustachian tube pressure is slightly negative compared to an adult. Most children, even those who are not suffering from middle ear disease, have difficulty in maintaining appropriate pressure. This leads to an increased incidence of middle ear disease in children. As soon as the nitrous oxide gas administration is stopped, it rapidly displaces out of the middle ear, creating a high negative pressure which may promote insufflation, aspiration, or reflux of nasopharyngeal secretion into the middle ear. Thus, some children may report of ear pain after the procedure. Several emotional disturbances, psychiatric disorder, or drug related discrepancies. Many psychiatric patients are not able to handle the dental treatment due to the higher anxiety. Such patients may be receiving psychotropic drug which usually alter the cerebral cortex function. They may also be on medication bringing about some sedation. Therefore, nitrous oxide sedation should be carefully administered in such children who may need close monitoring since their reaction may be unpredictable. Treatment with bleomycin sulfate. Bleomycin is an antineoplastic antibiotic used in the treatment of certain neoplasms such as Hodgkin's and non-Hodgkin's lymphoma. Patient receiving bleomycin therapy may develop interstitial pneumonitis. Here is an increased risk of developing pulmonary toxicity when oxygen is administered to the patient who have received bleomycin. It is reported that patient can develop respiratory failure when exposed to oxygen in a concentration greater than 25%. Since during nitrous oxide sedation oxygen concentration vary from 100 to 30%, such patients will be at high risk of respiratory failure. Autoimmune disorder or children on immunosuppressive therapy. For children who are already immunocompromised, their warehouse reserve of immune cells is already very low or fragile. If nitrous oxide is used too often, it can push an already weak immune system into a danger zone where child cannot fight off even minor infection. Cobalamin deficiency, because it reacts with the vitamin B12 and oxidize cobalt, which create enzyme that make DNA, and without DNA synthesis your body cannot create new cells. Children who are in pre-cooperative stage. The children do not have a cognitive ability developed enough to understand the use of nasal wood. A child who is less than 30 months usually will not understand putting a mask on the nose. Even if they allow, they may not let it stay there for more than few minutes. If the mask is put forcefully on the child's nose by using restraint, then the child may get more anxious. Extremely anxious and fearful children who are crying uncontrollably. It is very difficult to explain the process of using nitrous oxide in such children, and hence this technique may not be successful. A child who is usually unresponsive to audiovisual distraction will usually not inhale nitrous oxide efficiently. Children who are unable to communicate. Children who gets treatment done using nitrous oxide. So once exposed to nitrous oxide, the child may demand its use even though no treatment is required. This is because of the euphoric potential of nitrous oxide. In such a situation, dentist should counsel the child against its unnecessary use. Then children with behavioral issues. Child suffering from multiple sclerosis. So, hysterical, stubborn, or defiant patients may be difficult candidate for introducing nitrous oxide mask, and frequent exposure to nitrous oxide for preferring dental treatment in a child suffering from multiple sclerosis is not recommended as it may cause neuropathies. Patients with multiple sclerosis suffer from nerve demyelination and the symptoms may worsen by nitrous oxide induced neuropathy. Local causes. Surgery involved the anterior surface of maxilla. Nitrous oxide sedation required a nasal hood to rest on the upper lip throughout the dental procedure. If any surgery has to be carried out in an anterior surface of maxilla, it becomes difficult to retract the upper lip for surgical access. Mouth breather. A child who is a mouth breather because of obstructive causes such as nasal polyps, deviated nasal septum, or enlarged adenoids may find it difficult or impossible to breathe through the nose, and they won't be able to breathe through the nose, thereby making nitrous oxide sedation ineffective. Difficulty in breathing through the nose and upper airway infection. Advantages: fast onset, ease of administration, sedation level can be adjusted based on response, quick recovery, ability to communicate during procedures. Safe compared to other agents, no impact on daily duties. Disadvantages: poor acceptance of nasal mask. Children who are extremely anxious may not accept the nasal mask readily, leads to an ineffectiveness of nitrous oxide sedation. Relative weak potency of nitrous oxide or oxygen, sometimes even at a higher concentration of nitrous oxide, the children may not have reduced anxiety or may not have clinically desired level of sedation. Difficulty in introducing nasal mask in a children of precooperative stage. Children who are less than 3 years old usually do not have cognitive ability developed enough to understand the use of nasal mask. Hence, they may not allow the mask to be used, because of which nitrous oxide sedation has a smaller role in children who are less than 3 years old. Associated with nausea and vomiting. Fewer children develop nausea or vomiting on using nitrous oxide sedation. No role in post-treatment pain. This is usually seen after placement of stainless steel crowns without local anesthesia. So LA should be given in any procedure that can cause pain. Cost of equipment. Now coming to the stages of anesthesia. 4 stages of general anesthesia was recognized by Goodell's classification: induction, excitement stage, surgical anesthesia, and overdose. Stage 1 of anesthesia begins with the induction of the anesthesia and ends with the patient's loss of consciousness. Patients still feel pain in this stage. During nitrous oxide inhalation sedation, the patient always remain at the first stage of anesthesia. In the first stage of anesthesia with nitrous oxide, Carnot described 4 plateaus. Here plateaus is like level of sedation. So first is paresthesia. Paresthesia means pins and needle sensation. The very first thing nitrous oxide does is affect the tiny nerve endings in the finger, toes, and tongue. The patient feels a fizzy or tingling sensation. It's the sign that the gas has started working on the nervous system. So characteristic tinglings: patient experience tingling in finger, toes, and lips, and clinical sign: patient is fully alert and responsive. A second is vasomotor. Vaso means blood vessels and motor refers to movement or action. So nitrous oxide causes the blood vessels near the skin to open up, means it causes vasodilation. When blood flow closer to the skin, the body temperature feels higher. The patient feel a flush or a wave of cozy warm over their entire body, and it's like stepping into a warm bath. So the characteristic is warm. Patient experience sensation of warm or flushing. Clinical signs: slight peripheral vasodilation and skin may feel warm. Then drift. Drift means to be carried along by a current without effort. Means like a boat on a water. At this concentration, the brain's connection to the physical weight of the body weakens and the patient loses their sense of gravity. The characteristic is the float. Patients experience euphoria. Euphoria means the sensation of drifting or floating in the air. This is why they get the far away stare. They are mentally drifting away from the dental chair. And centrally fixed pupils, far away stare, heavy limbs. Dream. Dream refers to the vivid mental imagery or dream-like state. The patient is is now so deeply sedated that they are on the edge of sleep. Their eyes close and they may experience actual dreams or hallucinations. They feel total relaxation. Speaking become very difficult because the brain is more focused on the internal dream than the external world. So the characteristic is the sleepy patient experience eyes closed, vivid dreams or imagery, and difficulty speaking, profound relaxation, minimal movement. In most dental or minor medical procedure, the drift plateau is the sweet spot. It provides maximum relaxation and mild analgesia while keeping the patient conscious. If a patient enter into the dream plateau, they are on the very edge of stage 2, which is excitement and delirium. Knowing these signs help you avoid over sedation. The paresthesia and vasomotor plateaus are of a short duration where the drift and the dream plateau can be maintained for several hours until the nitrous oxide inhalation is terminated. Children in the drift or dream plateau usually respond to the question by moving their head rather than talking. Their facial feature as well as arms and legs are noticeably relaxed. Now in 1968, Harry Langa simplified the four plateaus into the three planes based on how much nitrous oxide the patient is breathing. So think of this as a level of relaxation. So plane 1 light, which is 5% to 25% nitrous oxide given, relaxed and awake state, slight tingling in the finger toes, maybe some giggling because of laughing gas. Plane 2 is ideal, 26 to 55% given, dreamy and drowsy state, the sweet spot state, glassy eyes, throaty voice, warm feeling and pain is dull. Then plane 3 is heavy, 55 to 70% given, uncooperative state, hard stares, hallucinating feeling of spinning or falling and too deep. Langa called plane 2 is a relative analgesia because it is the perfect balance for dental and medical work. Now the level of nitrous oxide analgesia. So first is analgesia stage. In this stage, the patient is 100% conscious and the goal here is to reduce pain and anxiety. It is divided into moderate analgesia and dissociative analgesia. In moderate, 6 to 25% nitrous oxide given, happy and relaxed vibe. Patient feel the dental work happening but they don't care. They feel a bit high or euphoric. You can talk to them normally. They are fully present but very calm. No nausea here. Then 26 to 45% nitrous oxide given in dissociative analgesia. Detached vibe. This is called ideal clinical zone. The word dissociative means the patient feel detached from their body. They know you are working in their mouth but it feels like it's happening to someone else. So time feels like it's moving differently. A long procedure feels very short. This is where you get the floating sensation. Then second is amnalgesia, the forgetting stage. This is a medical hybrid word. M means amnesia or forgetting and analgesia means no pain. In this stage, the patients start to lose their memory of the event, in which there is analgesic anesthesia and light anesthesia. So in analgesic anesthesia occur when 46 to 65% nitrous oxide is given. Deep sleepy vibe. This is the gray area between being awake and being unconscious. Marked amnesia. The child might cry during the injection but when they wake up they will say, "Did you do the injection yet?" They have forgotten the painful parts. Nausea become much more common here. And light anesthesia, when there is more than 66% nitrous oxide sedation is there, unconsciousness is there, the patient is now under. They are no longer just sedated, they are entering a light state of general anesthesia. So complete amnesia, you lose verbal contact, the patient will not respond to their name. This is usually avoided in standard dental clinic unless you have an anesthesiologist present. Most of your pediatric cases should stay in zone 1B, which is dissociative analgesia. It is the sweet spot where the child is safe, cooperative and feels no pain. If you move into analgesia, you must monitor the airway much more closely because the child is very close to falling into a deep sleep. Then clinical sign and effects. So neuromuscular and motor signs, muscle tonus, significant reduction in tension, shoulder drop and facial muscle relax, which is smoothing of forehead creases. Posture, hands may slip off the armrest, legs uncrossed or go limp, fine motor control, loss of grip, child may drop a toy or stress ball. Then ocular signs, reduced blink rate and slower eyeball movement, partial ptosis means dropping of the upper eyelid, glassy or watery eyes often due to gas leaking near the bridge of the nose, and a fixed daze state indicates the patient is too deep in over sedation warning. Then sensory and cognitive signs, paresthesia, tingling in the extremities and tongue, vasodilation, a general feeling of warmth or flushing, altered perception, dissociation, feeling detached, and altered sense of time. Response time, increased latency, it takes them longer to answer a question. In our next session, we will do a deep dive into the technical consideration of nitrous oxide sedation. We will break down the full machine assembly, step by step operating protocol, the specific function of every component, and the essential mechanics of the scavenging system. Stay tuned for that. To get the PDF for this video or any of our previous topics, simply like the video, subscribe the channel, and drop a comment with the topic name and your email address. We will send the materials directly to your inbox. Thank you for watching.